Are you suffering from neuropathic pain and wondering which medication is more effective, Cymbalta or Lyrica? Finding the right treatment for neuropathic pain can be challenging, but understanding the differences between these two medications can help you make a more informed decision. Cymbalta and Lyrica are both commonly prescribed medications for neuropathic pain, but they work in different ways. Cymbalta, also known as duloxetine, is an antidepressant that works by increasing the levels of certain chemicals in the brain that help regulate mood and pain. Lyrica, on the other hand, is an anticonvulsant drug that works by reducing the abnormal electrical activity in the brain that can cause pain. While both medications have been approved by the U.S. Food and Drug Administration, FDA, for the treatment of neuropathic pain, they may have different effects and side effects for different individuals. It's important to consult with your healthcare provider to determine which medication may be more effective for your specific needs. Understanding Cymbalta and Lyrica. Cymbalta, or duloxetine, is an antidepressant that belongs to a class of drugs called selective serotonin and norepinephrine reuptake inhibitors, SNRIs. It is commonly prescribed for the treatment of major depressive disorder, generalized anxiety disorder, fibromyalgia, and neuropathic pain. Cymbalta works by increasing the levels of serotonin and norepinephrine in the brain, which can help regulate mood and reduce pain signals. Lyrica, or pregabalin, is an anticonvulsant drug that is primarily used to treat epilepsy, fibromyalgia, and neuropathic pain. It works by binding to calcium channels in the brain and spinal cord, reducing the release of neurotransmitters that transmit pain signals. This helps to reduce abnormal electrical activity in the brain that can cause pain. How Cymbalta and Lyrica work for neuropathic pain. Cymbalta and Lyrica work in different ways to alleviate neuropathic pain. Cymbalta increases the levels of serotonin and norepinephrine in the brain, which can help regulate mood and reduce pain signals. This can provide relief for individuals experiencing neuropathic pain by modulating the way their brain perceives and processes pain. Lyrica, on the other hand, binds to calcium channels in the brain and spinal cord, reducing the release of neurotransmitters that transmit pain signals. By reducing the abnormal electrical activity in the brain, Lyrica can effectively alleviate neuropathic pain. Efficacy of Cymbalta for neuropathic pain. Cymbalta has been shown to be effective in the treatment of neuropathic pain. In clinical trials, Cymbalta has demonstrated significant pain reduction in individuals with diabetic neuropathy, fibromyalgia, and chronic musculoskeletal pain. It has also been shown to improve overall functioning and quality of life in patients with neuropathic pain. Studies have found that Cymbalta can provide significant pain relief, with many patients experiencing a reduction in pain severity and an improvement in pain-related sleep disturbances. However, it's important to note that individual responses to Cymbalta may vary, and some patients may not experience the same level of pain relief as others. Efficacy of Lyrica for neuropathic pain. Lyrica has also been shown to be effective in the treatment of neuropathic pain. Clinical studies have demonstrated that Lyrica can provide significant pain relief in individuals with diabetic neuropathy, postherpetic neuralgia, and fibromyalgia. It has also been shown to improve sleep quality and overall functioning in patients with neuropathic pain. Research has shown that Lyrica can reduce pain severity and improve pain-related sleep disturbances in individuals with neuropathic pain. However, similar to Cymbalta, individual responses to Lyrica may vary, and some patients may not experience the same level of pain relief as others. Side effects and risks of Cymbalta. Like any medication, Cymbalta can have side effects and risks. Common side effects of Cymbalta may include nausea, dry mouth, constipation, dizziness, fatigue, and insomnia. In some cases, Cymbalta may also cause sexual side effects, such as decreased libido or difficulty achieving orgasm. In rare cases, Cymbalta may increase the risk of suicidal thoughts or behaviors, especially in individuals under the age of 25. It's important to monitor your mood and seek medical attention if you experience any changes in mood, thoughts of self-harm, or worsening depression while taking Cymbalta. Side effects and risks of Lyrica. Like Cymbalta, Lyrica can also have side effects and risks. Common side effects of Lyrica may include dizziness, drowsiness, dry mouth, blurred vision, weight gain, and swelling in the extremities. Some individuals may also experience difficulty concentrating or thinking clearly while taking Lyrica. In rare cases, Lyrica may increase the risk of suicidal thoughts or behaviors, especially in individuals with a history of depression or mental health disorders. It's important to monitor your mood and seek medical attention if you experience any changes in mood, thoughts of self-harm, or worsening depression while taking Lyrica. Factors to consider when choosing between Cymbalta and Lyrica. When choosing between Cymbalta and Lyrica for the treatment of neuropathic pain, there are several factors to consider. These include the severity of your pain, your medical history, any existing medications you may be taking, and your individual response to each medication. It's important to consult with your healthcare provider to discuss these factors and determine which medication may be more effective for your specific needs. Your healthcare provider can assess your condition, review your medical history, and consider any potential interactions or contraindications before recommending the most suitable medication for you. Consultation with a healthcare professional. Before starting any new medication, it is crucial to consult with a healthcare professional. They can provide personalized advice based on your specific needs and medical history. Your healthcare provider will take into account factors such as the severity of your neuropathic pain, any underlying conditions or medications you may be taking, and your individual response to different treatments. During your consultation, be sure to discuss any concerns or questions you may have about Cymbalta or Lyrica. Your healthcare provider can help you weigh the potential benefits and risks of each medication and guide you towards the most appropriate treatment option for your neuropathic pain. Summary and conclusion. In conclusion, both Cymbalta and Lyrica are FDA-approved medications for the treatment of neuropathic pain. They work in different ways to alleviate pain, and individual responses may vary. Cymbalta increases the levels of certain chemicals in the brain to help regulate mood and pain, while Lyrica reduces abnormal electrical activity in the brain. When choosing between Cymbalta and Lyrica, it's important to consider factors such as the severity of your pain, your medical history, and any existing medications you may be taking. Consulting with a healthcare professional is crucial to determine which medication may be more effective for your specific needs. Remember, finding the right treatment for neuropathic pain may involve some trial and error. It's important to be patient and work closely with your healthcare provider to find the most effective and suitable medication for your condition. With the right treatment, you can find relief from neuropathic pain and improve your overall quality of life.